Okay, thank you all for your engagement, your participation, and I just want to mention to the folks on webcast, I know that you have the poll everywhere information, and that seems to be the most efficient way for us to get all comments. So if you can just continue to submit your comments via poll everywhere after the sessions, and during webcast, if you refresh your browser, we should be able to capture your comments throughout the session. They may not be shown in the room because we have slides and we're doing poll everywhere, but we do want to capture those. So just refresh your browser. Your comment box should show up. And then make sure you continue to participate via poll everywhere so that we can see your questions in the room. So next, I'm going to introduce the next panel, which is our keynote, which is what is the current state of the science on early life inequities and its limitations in informing how to achieve health equity for all. So I'll be inviting Stuart Butler up, who will be moderating the session, one of our advisors. He's a senior fellow in economic studies at the Brookings Institution. And prior to joining Brookings, he spent 35 years at the Heritage Foundation as the director of the Center for Policy Innovation, and earlier as vice president for domestic and economic policy studies. I invite Sarah Wadamura up. She's an associate professor of psychology at the University of Denver, where she directs the Child Health and Development Lab and co-directs the Stress, Early Experience, and Development Research Center. She received her PhD from the Department of Human Development at Cornell University in 2005. And I invite Valerie Mahomes as well. She is the chief of the newly formed Pediatric Trauma and Critical Illness Branch at the Eunice Kennedy Shriver National Institute of Child Health and Human Development at the National Institutes of Health. In this capacity, she sets the vision and the priorities for research that addresses the continuum of psychosocial, behavioral, biological, and psychological influences that affect child health outcomes in trauma, injury, and acute care. Thank you.
We seem to have a science breakdown. Okay, here we go. As you heard, I'm one of those creatures that works in the public policy field. So part of what, if we're thinking about how to achieve equity, what we really have to do, of course, is to look at what's going on in the field, what the science is showing, and then think about how we can start aligning public policy to fit in with that. Oh, hold it close. Okay. Okay. So what we're trying to do is, as in the public policy field, is to try to figure out how to align what we know from the science into effective public policies. And you heard a little bit about that in the last panel in terms of how one thinks about how to learn from what the individuals heard in the field to effective public policy. Now, I am one of these people in public policy that actually believes that science should drive policy and legislation. We may be an endangered species, I'm not sure, but certainly that's what I believe. But as a public policy person, and as thinking about how to achieve equity, there were a lot of issues associated with thinking about science and what we know in the science of this area. One is that as somebody making decisions in Washington or around the states, to actually keep up and to know what is going on in science is a challenge. It's constantly changing. We learn more. What we thought we knew is either not the case now or is nuanced. So that's an issue. We also know that trying to think about where we allocate funds has got to be driven by this. And not only how we allocate funds with regard to programs, but how we allocate funds with regard to trying to do the research itself, how government and philanthropy should allocate its funding to encourage research in certain areas. So we've got to have some hypotheses and some thinking about where are the areas of opportunity as well as where are the issues associated with inequities. And so funding and science can be a complicated mixture in terms of how government itself should operate. So we're going to explore this a little bit in this panel in terms of what the science really seems to be telling us, and maybe some areas where we ought to be looking a little harder, particularly at areas of opportunity, things that there may be assets that we're overlooking in this field. So to begin, Sarah Watermura, I'm sorry, it's going to start. And you've looked at science in a lot of depth. And what does it tell us about inequities? And also, what are the glimmers of hope in terms of assets that maybe they're in the communities that we could be building on?